Hello, this is Dr. Gabe from First Look MRI, and this is a 38-year-old male who's a professional athlete. The patient has pain in the shoulder, and they have two fluid collections in the front of the shoulder in two separate compartments. And sometimes it's hard to tell which compartment the fluid is in, but this is a nice example where we can see pretty clearly which compartment each is in. So the two fluid collections that we find in the anterior shoulder, they can either be in the subcoracoid bursa or the superior subscapularis recess. Kind of difficult to remember names there, but I'll go over both of these here and start off with this. So this is an axial view. You can see the patient has big muscles. This is the deltoid here. The front, lateral, and the back of the deltoid is this huge thing over here. And we see the humeral head here. This is the glenoid part of the scapula. And we see this big dumbbell-shaped fluid collection here in the front. Wraps over the humeral head, and it's superficial to this black line. This is the subscapularis muscle. And this is a central tendon that comes over here and attaches to the lesser tuberosity in the front of the shoulder. This is part of the rotator cuff, so it's superficial to the rotator cuff and in front. And this is the subcoracoid bursa. So it's below the coracoid process, so I call it the subcoracoid bursa, and it can be pretty big like this. On a sagittal view here, we can see the same thing. This is the humeral head. Here's the shaft. Here's the front. Here's the back. Up the top is here, you can see the AC joint to get oriented. So this is that fluid collection in the subcoracoid bursa. So this is a coracoid process. It's below that, so they call it the subcoracoid bursa. These fluid collections do not communicate with the joint, and they come way down low here. This is large. Sometimes there's just a little bit of fluid, and it can be hard to tell. But the other fluid pocket in the front here, or fluid area, is right here. Looks like a little teardrop. A little bit more complex. This is part of the shoulder joint. This is in the front of the shoulder joint. Just above this, you can see there are two separate components. And it hangs over the subscapularis, so they call this the superior subscapularis recess. Because it's not really a definite distended bursa, it's a recess in the front of the shoulder where fluid can accumulate. So the superior subscapularis recess beneath the coracoid process immediately, kind of drooping over the subscapularis tendon, and again the superior subscapularis recess, and then this larger thing down below that does not communicate with the joint. This is called the subcoracoid bursa or subcoracoid bursitis. For the longest time, I'd have to look up what they called these each time because it's pretty confusing. But that is it. Hopefully that's helpful, and I hope you have a wonderful day.